Hello, good evening once again. This is Nestella. Before I begin, I would like you to subscribe, share, and like this video so that it will motivate me to do more educative video like this. Today, our topic for discussion is anemia in pregnancy. So, what's anemia in pregnancy? So, anemia in pregnancy is the low level of hemoglobin or red blood cells in your blood when you start the pregnancy journey. So, in the first trimester, anything below 11 deciliter, 11 gram per deciliter in the first trimester is considered a low HB, or you are considered to be anemic, and anything below 10 gram per deciliter in second and third trimester is also considered as anemia. Okay, so what are the signs and symptoms of anemia? One, you feel dizzy, you feel fatigued, you feel cold sometimes, and dizziness, you feel pale. Anybody see you to be pale, or anybody who sees you knows you are pale, even not the health professionals, anybody can tell that you are pale. That one too is a factor. And then there is also palpitations, or let's say fast heartbeats. Your heart begins to beat faster than normal. That one is also a sign of anemia. So what are the types of anemia? We have iron deficiency anemia, folate deficiency anemia, and vitamin B12 deficiency anemia. Iron deficiency anemia is it means your blood has low levels of ions in it. And then folate means you lack folic acid, and then vitamin B12, as the name says, you lack the vitamin. Okay, so we have let's say treatments with regards to the severity of the anemia. We have mild to moderate anemia. That one you can use supplements, you can eat to replace it. But the severe anemia, another type is the severe anemia. The severe anemia, you would have to take transfusions in severe cases where the HB is less than 7 or 8. It depends on your health practitioner. You could be transfused though. From 9, sometimes we could give you supplements or hematinics to be to boost up the blood level. Yes, so before you could prevent anemia, you would have to take your supplements daily. Your iron or folic acid supplement, you have to take it daily. Vitamin C supplements, you have to take it daily. And then you make sure you eat a balanced diet. You make sure you eat a lot of diets containing iron, or a lot of meat, green leafy vegetables. You have to avoid caffeinated drinks. You have to avoid coffee and all those things that wouldn't help you and your baby. And if you smoke, you have to stop it. If you smoke too, that one too is not advisable. Excessive drinking is also not advisable here, because it all these are all inhibitors, okay, to make your red blood cells produce a lot. So these are inhibitors to red blood cells production. So that one too, you have to put a stop to it if you find yourself in any of these habits. And who are at risk of getting anemic? One, pregnant women who are pregnant with more than one baby. So if you are twin gestation or triplets, that one you are at risk of being anemic. And then not getting enough iron in your diet, that one too. And you experiencing heavy menstrual flow before the onset of the pregnancy, that one too, you are at risk of getting anemic in your pregnancy journey. Okay, and then vomiting a lot, or due to morning sickness, especially in the first trimester. Mostly it happens in the first trimester, but I'm not saying if you're in the second or third trimester you can't vomit. Sometimes disease condition, infections can also put you prone to be anemic, because you are likely to vomit and all that. Okay, so if you feel, and one important thing is that you have to consider all your ANC appointments importance. You have to treat it with urgency and then a level of importance, okay? Because you don't have to miss your ANC visits with your gynecologist gynecologist or obstetrician or your midwife. You don't have to miss any of these appointments for nothing. Okay, so when you come to the facility, that's when we get the chance to do the lab test, the full blood count. We get the chance to screen you of any infections and all that to treat accordingly. So and that's where we could prescribe the medications for you, the daily supplements for you to be able to take them. So I would treat all pregnant women to, take their A and C very serious.